Hi, everybody. We are back. We're talking more about nutrition and changes in the aging body. And in this webinar, we're going to talk about all of those little signs that you probably don't notice that indicate nutritional concerns in yourself and in your elderly parent. And many of them you can notice by looking at your body, by looking at yourself. But as always, guess what happens next? It's time for housekeeping. So let me advance this slide and we'll get going. I use the term elderly parents for the person for whom you provide care. You may be a professional caregiver caring for clients. You may be a family caregiver or a friend caring for a loved one. Print out the outline for this module, print out the slide handouts, take notes as we go along. Fill in the blanks, the dots. Let's talk about the objectives of changes in the aging body and signs of poor nutrition. At the end of identifying changes in the aging body, you should be able to begin to formulate the connection between aging, chronic disease, and nutrition. You should be able to identify signs that can indicate malnutrition. So where before you looked at your elderly parent, you had no idea if they were malnutritioned, now you'll have some signs to look for. You should also be able to seek treatment and recommendations from healthcare partners about how to improve nutrition, because we don't want to let this continue on once we know that it exists. Being diagnosed with multiple chronic diseases, what do you think it increases? It increases the likelihood of being malnutritioned because chronic diseases place stress on the body. Changes in the aging body occur and they relate to all of these chronic conditions that can start with these little signs 10 or more years before you're actually diagnosed. So by the time you're actually diagnosed with a chronic disease, if you haven't sought regular medical care, you could have had that disease for 1 year, 5 years, 10 years. And then all of a sudden, you have a second. One disease affects another. One body part affects another. By now you know this. You'll hear me repeat these interactions between body systems throughout the program because it is so important. This should help you begin to apply a thought process of correlating how one medical condition relates to another. Here's an interesting fact. Research links poor dental care to pneumonia. How many of you would have ever imagined that? Research links high blood pressure to circulatory issues to vascular dementia. Everything links, everything works together. We're going to review a list of simple signs of poor nutrition that may indicate underlying health problems. So if you don't already have a chronic disease, one of these may indicate a chronic disease or that you have another one that you don't even know about. Discussing these concerns with a doctor is very important. If your doctor responds with a, nothing can be done attitude, it might be time to find another doctor or to request a referral to a specialist who actually will take an interest in your care. A thorough discussion of how to talk to your doctor about nutritional concerns is in another part of this module. So I'm going to take you through signs and then we're going to talk about how do you talk to your doctor about this. As we've talked, doctor appointments shouldn't be a one-way conversation, not the doctor just talking at you. As the caregiver, as your elderly parent, you want to have that list of things to discuss. You want to have the agenda so that you get better results and better treatment. So let's take a look at a few signs. We talked about this one, feeling tired. Feeling tired and lacking energy can be a sign of poor nutrition or anemia or another condition. Being tired, though, does relate to a poor diet and other chronic health conditions like heart disease, COPD, thyroid disease, and others. In the elderly, you don't have any energy. That results in decreased physical activity, which we know by now is that downward spiral to having more health problems, being less physically able, and needing more help from caregivers. Brittle and dry hair. How many of you look at your hair and it's brittle, it's breaking, it's falling out? Brittle and dry hair results from the body not getting enough nutrients and vitamins. A poor diet equals poor nutrition. Eating the wrong type of food or not enough food negatively affects how the body looks. It affects your body's visual appearance. Brittle and dry hair can be compared, I like to compare it to the appearance of a tree. So when a tree is healthy and it's in summer, got green leaves and the tree is plentiful, it's beautiful, you want to sit underneath it, it's just fabulous. But you might be walking down the street, you might see another tree that doesn't look so happy. That tree is diseased. The leaves might be turning yellow, they could have spots on it. The tree looks like it's suffering, it looks like it's in pain. If you're going to sit under like the tree with the green leaf or the sick tree, which tree do you want to sit under? You want to sit under the green tree. The body is similar to trees. Our physical appearance is very much affected by the food we put into the body, by the fuel that we put into our bodies. Let's talk about our hands. Look at your nails. Look at your hands. What do you see? They look good? They look like the picture in the slide, or maybe not so good. The condition of our skin and of our nails can be another indicator of health problems. Although trying to figure out what causes nail issues, that can be a challenge. Our older adults can have very thick toenails that can't be trimmed. We'll talk about toenails in a minute. But poor nutrition, liver disease, kidney disease, a fungal infection, bronchitis, psoriasis, or eczema, itchy skin, are a few of the causes of skin and nail concerns. Seeing your doctor is the best way to diagnose whether fingernail issues relate to malnutrition or another health condition. And if you have severe problems with toenails, ask for a referral to a podiatrist, which is that medical specialist for your feet, for your ankles, and your lower legs. Because sometimes, again, a primary care physician may not have all the answers. Let's talk a little bit more about our teeth. Oral health relates to the quality of teeth or the use of dentures. Dentures can be poor fitting in a lot of cases. If your teeth are decayed or infected and gum disease is present, eating and chewing might be painful. There may be infections. And if your parents have difficulty chewing, that may increase the likelihood of the foods that they eat or don't eat, and it can result in nutritional challenges. If you have cavities or bleeding in your mouth or your gums are irritated, that can also make eating painful or difficult. Believe it or not, smoking increases the likelihood of dental decay and periodontal, or what's called gum disease. Annual teeth cleanings, ongoing dental care significantly lower that risk of cavities, and it's easier to chew foods. Good oral health increases the likelihood of having better nutrition. Let's talking about flossing for a minute. It's important to floss your teeth to remove bacteria and plaque. It's that sticky stuff on your teeth. But elderly parents, they might have arthritis in their hands that can make it more difficult to brush and floss twice daily. Elderly parents might see dental care as less important when it really does become more critical with age. Dental infections can send bacteria into the lungs that turns into pneumonia. Untreated dental infections can result in death. I have seen this happen in elderly clients. And as a result of chronic health diseases, medications can cause dry mouth, and believe it or not, dry mouth can lead to cavities. So let me share a little bit about my own personal dental health life. So when I grew up, my parents really didn't focus on brushing teeth or flossing. I mean, like hardly at all. And so by the age of, I want to say, gosh, 8, 9, or 10, I had a mouthful of cavities. And I mean a mouthful of cavities. Probably 2, 2, 2, and 2. So 2, 4, 6, 8 cavities in my back molars that required painful fillings. Remember those old silver fillings? It goes in the dental chair for hours. That alone was the best lesson for me on the fact that I should take care of my teeth, because look at all the issues I caused from not brushing my teeth. But my parents didn't know to tell me this. So my parents were interesting. My mom lost all of her teeth by probably the age of 35 or 40. She was already wearing dentures. My dad had the best teeth in the world. When he passed away at the age of 82, he had a full set of teeth. He learned how to take care of his teeth in the Army. So it shows you that different life experiences of having parents who teach us to take care of our teeth, those who know that to take care of our teeth, or our own personal experience of having bad teeth. I tell you, after those 2, 4, 6, 8 fillings, I brushed twice a day, I flossed. I went to go get my teeth cleaned every 6 months. And probably from that time until, I would say, my middle ages, those fillings lasted pretty darn good. I had a really good dentist. His name was actually Dr. Steiner. I remember him with great fondness. He had a great sense of humor. But Dr. Steiner did a great job with my teeth, and it wasn't until my middle ages that those fillings got old and started to fall apart. And unfortunately, you have to have them replaced. So all of those 2, 4, 6, 8 happened again in another 2, 4, 6, 8. I had to have the fillings replaced. In some cases, I had to have crowns. In some cases, root canals, because, once they start to mess with those old teeth, they get very unhappy. And for any of you who have had root canals and crowns, it's not a pleasant experience. But now, unless I don't take care of my teeth, I probably am not going to have any more cavities, never going to have any gum disease. I will be like my father when I die, probably with all of these teeth still in my mouth. That is a good thing. I'll be able to avoid gum disease. I'll be able to avoid pneumonia that is very common in older adults, as long as I keep doing what I'm doing. Yes, brushing your teeth, flossing your teeth takes a little bit of time every day. But I'll tell you, when it comes to your health, you can avoid so many health problems. When it comes to the health of your elderly parent, you can help them avoid so many health problems. In another webinar, we'll actually talk about how to help your parents brush your teeth. We talk about everything in these webinars, because I don't want you to be surprised about anything that someone hasn't told you that you say, oh, she never told us that. I'm giving you everything in these webinars. Let's go to the next slide. Let's keep advancing here. Constipation, another subject for the elderly. Constipation happens when there are low amounts of fluids or fibers like whole grain, fruits, and vegetables in the diet. So if your elderly parents are not drinking enough, if you are not drinking enough, if you're not getting enough fiber, you're going to become constipated. Hard stools that you try to pass result from dehydration. Bowels in the elderly can become impacted as a result of poor nutrition and dehydration. That means that your elderly parent is trying to have a bowel movement and nothing is happening. So constipation, diarrhea, dehydration, very common in the elderly. And constipation can have a negative effect. It can result in not feeling hungry. Chronic constipation is common in elderly adults at rates of 30 to 40% of adults who live at home. People who live in nursing homes, older adults, 50% of them are constipated on a regular basis. There are so many side effects of constipation that you might not expect. Headaches are a possible side effect. Individuals who are constipated are usually dehydrated. Then you've got dehydration that's spiraling into other things like headaches and feeling nauseated. Then, how many of your elderly parents constantly worry about their bowel habits? They're either constipated, they're having dehydration. That results in a lot more stress. As we talked earlier, poor nutrition affects the visual effects of our body. Constipation can result in acne, oily skin on the face, dark circles underneath your eyes, and skin rashes because toxins are trying to exit your body. They can't get out through your bowels, they're trying to go out through your skin. When you're not drinking enough water, the results on the body go past constipation. You can have body pains from cramps, headaches, skin issues. You can have bouts between diarrhea and constipation, so back and forth. If it's a common occurrence, see your doctor for solutions. But honestly, if you eat an apple a day, this is going to sound crazy, but try eating an apple a day and see what changes with your bowel habits. My guess is that if you had constipation, it'll probably go away. Eating fiber, so cereals, oatmeal, whole grains, not white bread, but wheat bread. All of those things can help your body process your food and your nutrition better, and it can help you avoid constipation. And remember, try to drink at least 64 ounces of water every day. Let's talk about our stomachs and digestion. Changes in our digestive system begins with age, probably around age 40 or 50. Slower digestion of food and difficulty absorbing prescription medications happen with age. And we'll talk about gastrointestinal issues like, do you have heartburn? Do you have GERD, which is gastroesophageal reflux disease, fancy medical term? Diverticulitis, do you get particles stuck in your intestines and your colon, and that results in bleeding when you have a bowel movement? Do you have hemorrhoids? Do you have gastroparesis? Are you lactose intolerant? Do you have food allergies? Do you have irritable bowel syndrome? Any one or more of these can affect your desire to eat. They can affect your appetite. Stomach concerns can result from cigarette smoking. We'll talk about this in just a minute. But if your elderly parent has any type of stomach issues, I recommend requesting a specialty appointment to a gastroenterologist for a thorough health review and treatment and recommendations. Having ongoing stomach concerns mean that your food's not moving through your digestive tract like it should. You or your parents might have bloating and gas. Then you have less of an appetite because you can't pass the gas and have that bowel movement. Really, stomach problems make us feel, honestly, just miserable. So a few months ago, I did a radio program, The Caring Generation, and it was about the idea of smoking and stomach issues. Because my mother, when she was alive, was purely miserable. Again, another reason. So like all the bad teeth made me go to a dentist. Watching my mother suffer made me become very adamant about health. What we didn't realize, though, with my mother was when she smoked, she had a ton of stomach issues. She had a hiatal hernia, gas, bloating. I think she drank like a bottle of Maalox every couple of days. Have you ever tasted that stuff? Yuck. Tums, you name it. Stomach issues, GERD, miserable. She smoked a pack of cigarettes a day. Doctors back then didn't see the connection between smoking and stomach issues. All the doctors told her was that she should stop smoking, not really why she should stop smoking. She had horrible heart disease. That was really the primary reason. But the secondary reason would have been all those stomach issues. But nobody talked about that back then. If you have any type of stomach issues and you smoke, you can take precautions. Go see a gastroenterologist. Find out what's going on with your tummy. Most of all, if you can give up those cigarettes, give them up, because in addition to stomach problems, dental problems, heart problems, circulation problems with your kidneys, smoking causes so many health issues. And smoking is a habit, just like many of the other bad habits that we all have. We can choose to change our habits, have better health, or we can choose to suffer later in life. What's your choice? Let's talk about emotions and nutrition. A poor diet and a lack of nutritious foods greatly affect our lives. How many of you can tell how your mood changes when you feel, I call it hangry? You're hungry, you're starving. I can tell you my energy level drops and I become pretty darn irritable. Elderly adults who live alone, in addition to having these hangry effects, may not be motivated to eat unless another person is around to encourage eating and to share food. When I had my caregiving agency and my caregivers would go see clients, one of the most frequent requests was, can the caregiver sit down and eat with the elderly person? One of my concerns was I didn't want my caregivers eating the food of my clients. So I always suggested that they carry some type of food or a snack with them so that if they were making a meal for the client, they could sit down with the client and eat something that they brought, because I didn't want them getting reliant on eating the client's food. Other issues with nutrition. It's a weakened immune system. So the immune system in the body fights off infections like colds. If elderly parents are continually using their body to fight off an illness, that immune system can become weak. Elderly parents may recover from a cold and then quickly come down with another ailment. So poor nutrition has an effect on the body's ability to maintain and fight off diseases. Viruses like the flu, the pneumonia, the norovirus, this nasty coronavirus, they are prevalent in the elderly with health conditions. As the news reports about this coronavirus, the elderly and the young are particularly susceptible. Many of these viruses are deadly for the elderly because they have multiple chronic conditions, breathing concerns, and poor nutrition. Care communities where the elderly typically live, nursing homes, lock down the doors when a virus spreads through the community. That lockdown or quarantine allows better care to sick residents. It also prevents visitors from unintentionally bringing germs into the community, which is where the young are involved here. Younger people can carry viruses and not have the virus, so they can easily pass it along to elderly parents. Care of the elderly who live in care communities rarely receives little press until now we have this virus and everybody's talking about it. Communications about precautions that family and visitors who might be sick should take is often missed or not communicated. However, I think that's really changed now with this virus. Anybody who has the slightest illness, even the common cold, you shouldn't visit your elderly parents or any older people because of the risk of transmitting that virus. Then we have the subject of wounds that won't heal. The effects of taking medications like blood thinners can result in skin bruising. So if you see an elderly parent and they have these purple bruises all over their arms, they may be taking a blood thinner or another medication that's causing that. The other cause is that as we age, our skin becomes thinner. Have you seen, if you look at your skin and you pinch it, and then you look at your elderly parents and you pinch it, their skin is so thin that they can experience what are called skin tears. Not getting enough vitamins and having poor nutrition results in all of these skin issues, like bruising and wounds that are very hard to heal, or wounds that don't heal at all. People diagnosed with diabetes are very high risk of skin wounds that are more difficult to heal. In the 20 years that I was responsible for the care of my clients as a power of attorney and as a care manager, I had clients diagnosed with diabetes, dementia, cerebral palsy, multiple sclerosis, all of who were malnourished, malnutrition to a degree. Poor nutrition can result in skin wounds that can advance to severe bed sores that require extensive treatment. And I want to share a story of a client of mine. And this client's name was Robbie. And the client had cerebral palsy, which is a disease that affects mobility, but still was pretty active. Robbie got around in a wheelchair, was able to roll around, and even to the extent that had a special wheelchair that Robbie rolled around outside. Robbie would drive to the grocery store in her wheelchair because she lived close, She'd go pick up the mail. All the neighbors knew Robbie. For a long time, Robbie did really quite well until she progressed into about the age of the 70s. And then all of a sudden, Robbie started having more health issues that related to digestive issues in the stomach and poor nutrition. And over time, this poor nutrition created in or resulted in skin wounds and Robbie becoming physically weaker. So Robbie then could not roll to the grocery store in her wheelchair. She could not roll to the post office. Robbie needed to live in a care community where there was support, which she did for a while. And eventually, Robbie became so physically weak and unable to take care of herself that she had to move into a nursing home. Well, as you know, a lot of elderly in nursing homes, where do they spend a lot of time? It's either sitting in that wheelchair or lying in a bed. And when you have cerebral palsy, that means you're sitting on your bottom a lot. So over time, Robbie had skin wounds that were called decubes or decubitus ulcers on her bottom. And initially they were small and they would heal. Initially, though, these skin wounds got significantly larger and larger and larger. And when I mean larger, I'm talking skin wounds that were 5 or 6 inches wide and deep. And I don't want to gross you out by explaining them in further detail, but these wounds are very serious and they're life-threatening. So for a long period of time, I would go with Robbie to appointments to a wound care doctor. And that wound care doctor would debride or clean out those wounds to try to get the good skin to come back. And Robbie would take a lot of nutritional protein supplements because blood work showed that Robbie's protein levels were low. So once you get into this spiral of having skin wounds and having low protein, it's very dangerous for older adults, especially when you have large skin wounds. Eventually, those skin wounds became life-threatening for Robbie, and she passed away from those skin wounds. But this can happen with anybody, any older adult who sits a lot, who sits in a wheelchair or sits in a chair for 8 or 9 hours a day. They become sedentary and they don't think that's bad. But if they have poor nutrition, they are more likely to have these skin wounds. And in another section, we'll talk about how to notice these skin wounds, how to report them to the doctor before they become serious or life-threatening. It really is a bad situation for older adults. And a lot of times, depending on the progression of the skin wound, you can't turn it around. I've had many clients over the years who've had cerebral palsy and multiple sclerosis and diabetic conditions. Skin wounds are so very serious and so very tragic, something that we want to avoid if at all possible. So let's talk a little bit more about the importance of monitoring skin. If your elderly parent has the conditions that we talked about or any chronic condition that represents a nutritional risk, you do want to monitor and look at the skin for red areas that very quickly, within a number of days, can turn into sores and that can eventually turn into these wounds that can be life-threatening. These chronic wounds are a severe issue for the elderly, those diagnosed with diabetes, circulatory problems, cerebral palsy, those who are obese, overweight, who sit for a significant part of the day. As in my client Robbie, wound healing is very difficult when poor circulation, poor nutrition, swelling, nutrition, or repetitive movements occur. Pressure injuries can result from just bumping an ankle on the leg rest of a wheelchair, or in people who sit or lay in positions, the same position for long periods of time. For example, skin wounds are more likely in an elderly parent who sleeps in the same position, especially if they can't turn or shift weight from one side or another. Skin wounds are more common in people who sit for long periods of time in a wheelchair or a chair, especially when they can't shift their weight. There are special chair cushions and other accommodations that you can get that we'll talk about. The elderly with wounds or pressure ulcers are usually admitted to the hospital, but interestingly enough, for reasons other than that pressure ulcer, then all of a sudden The hospital staff notices pressure ulcers. The most common health conditions that take elderly parents into the hospital are not taking medications correctly, pneumonia, urinary tract infections, congestive heart failure, any type of breathing issue, diabetes, and septicemia, which is called sepsis. And sepsis really is just a multiple body infection. My mom actually died of sepsis. But the prevalence of skin wounds increases, so it gets higher as a result of having any of these infections and a chronic disease. So let's talk about how to notice some of these wounds. As a refresher, if your parent has any of these conditions, you want to ask if you can do a skin check for wounds, and I mean a total body skin check. So maybe when mom or dad is getting dressed or changing clothes, or maybe when they go to the bathroom, you can just ask if you can take a quick peek, because a skin wound can start as just a simple scratch or a bruise, or you've got a red spot on a body part, and then within days, it is something way more serious. And so if you notice a wound, it might have difficulty healing, but you might notice these symptoms that I'm about to mention. So get out your pens, but you want to contact the doctor immediately when you notice these things. Any type of a wound that is open, meaning the skin is broken. The wound looks red, irritated, or swollen. Anytime your parent has a fever. If that wound hurts to the touch, if it's painful, if it's numb, if your parent can't feel you touching it, that is a significant sign. If there isn't any sign of healing, so if no new skin is growing around that wound, and there's like weeping or any type of a discharge, that's a sign to go to the doctor. Very important sign, especially if that wound looks infected or yellow or there's pus. Go see the doctor right away. And even worse, if that wound is turning black, that means that dead skin tissue is around the wound and it's not allowing the wound to heal. Any of these, get to the doctor right away. It's a serious situation. You do not want to let it advance any further. I want to talk about blood work because there's differing opinions on, does blood work, is it a good indicator of low protein? Is it not? Should it be taken? Should it not? My recommendation, always err on the side of caution. If you got a chronic disease and you have a wound care specialists will usually draw blood work to monitor protein levels in the body that can indicate the type of infection or malnutrition. A primary care doctor may not do this. Always ask to go see a wound care specialist. The most widely used measures for blood work, these are medical terms, but serum proteins. So albumin, transferrin, prealbumin, retinol binding proteins. Blood sugar and A1C levels are also important for diabetics. A complete blood count, also called a CBC, that's another medical speak term. It's another test that they can run to determine how your body's doing to see if it can actually support wound healing or if you need extra measures. If a doctor runs a blood test, be sure to ask about the test and ask for a copy before that sample is taken too, so that you can understand whether all of these numbers and components and how they work together. You do want to ask for a copy of the blood work results and have them explain all the measures to you so that you fully understand whether your parent's body or your body is able to heal the wounds. And so that you can start comparing blood test after blood test if these measures are getting better or worse, because you have to be that person who says, you know, we got to take more steps. We have to do more. It doesn't seem like it's working. You've got to talk about other steps like nutritional supplements, wound care processes. Believe it or not, if you're a caregiver, you may become involved in providing and performing wound care treatments at home. Takes a little bit of skill, but you can do it. Treatments and procedures previously performed in hospital settings and by healthcare staff are now being performed by family caregivers. As a caregiver, you will continue to provide more of this hands-on type and medical care in the home, which really is considered the new hospital these days. So let's do a summary of changes in the aging body and signs of poor nutrition. Now that you know the signs and the symptoms of poor nutrition by looking at your body, by looking at symptoms like you have stomach issues, skin issues, you can monitor signs for nutritional changes. You can be proactive in discussions with medical professionals about specific steps to improve nutrition and to treat wounds. You also know a lot more signs that are associated with chronic diseases, and you now know how quickly wounds can become dangerous. Malnutrition is a very serious subject for elderly parents. It's a subject that you want to be proactive about. Don't wait if you notice these signs. Get to a primary care doctor, ask to see a specialist, a gastroenterologist, an endocrinologist, a wound care specialist. Don't wait. Don't allow your elderly parent to suffer because of these conditions that can be treated. I'm Pamela D Wilson. Thank you for joining me for this webinar. I know it was a little bit of a difficult subject, an uncomfortable subject, but wounds do happen in elderly parents. Again, I don't want you to be surprised. I want you to know about all of this so that you can take preventative steps for yourself and elderly parents. I will see you again in another webinar.